Hey everybody, it's Dr. Nelson. We're talking about conditions, especially spasms, and how chiropractic can help. Now this one's a little bit more common. I've been making some videos on things that a lot of people didn't know chiropractors can help with. This one though I think is a little bit more run-of-the-mill. So if you're dealing with spasms, first off, I'm sorry. Second off, if you or a loved one are dealing with these and you want to learn more about them, check this out. I'm going to keep it nice and tight. Pun intended. All right, coming back to this, we have two vertebrae here. These are not perfectly anatomically accurate, so if you want to rip me a new one in the comments, go right ahead. It helps me in the algorithm. Appreciate it very much. The purple thing right here is the nerve, so we're looking at the spine from the side. The nerve exits between the vertebrae here, and what we find is that joints that don't move correctly inflame, which pisses off the nerves, which tighten up the muscles, which connect back to the joints. Now, if that inflammation, for a lot of people, it's just tightness, okay? Especially if it's right as the nerve is exiting the spine. But if for whatever reason there's a bulge of a disc or the big old ligament right back here in the back that kind of defines the back side of that spinal canal where that spinal cord comes down, if this drops in height, which happens commonly with people with degenerative disc disease, arthritises, part of the degeneration that happens with aging. Some parts of it are natural, some parts of it are early degeneration. If that starts pushing in and starts pressing or inflaming that nerve, especially in the spinal canal, you can end up with spasms. These are what we call upper motor neuron symptoms. They come from spinal cord and higher in the brain. The tightness, that's more of a from where the nerve exits on outward sort of issue. So just from how someone walks in the office, I have a really good idea of what's going on and where the root cause of the problem is. So what can we do about it? Well, the first and most important thing is we have to get those muscles to let go. But we're not going to do that by fighting the muscles. Instead, what we're going to do that is by creating space in that joint so that the nerve has room to breathe. So what we're going to do is we're going to recommend traction therapy, which goes beautifully hand in hand with the chiropractic adjustments we deliver. And that's going to help those joints to be able to open up, to help that nerve have room to exit and to be able to really be able to function properly. And if there's a bulge on the disc or some pressure from the ligament flavum in the back here pushing on that nerve, it's going to be able to stretch that out, straighten it out, and be able to open up that space. Now, not all of these cases are successful. We're batting about 6 out of 7, about 85 to 87% for these types of issues, which is still pretty good. I'm very proud of that. I've had amazing teachers, and so I'm really excited to share this protocol with people. And we also cultivate great partners in our community through our Wellness Coalition and other partnered offices to make sure that if someone is not a fit for our care, or if after a conservative trial of care, it's just not working for them, we can refer them to an office that can offer more than we can, that might be that next perfect step for them. So traction for the joints, adjustments for the joints, that's going to help the nerves calm down. Red light therapy is also tremendously helpful for the nerves. It helps to decrease inflammation, and it's very warming. It's incredibly comfortable. Most people report feeling either nothing at all or just some mild warmth, and 10 minutes in a zero gravity chair is hardly suffering. It's a part of almost every treatment here at Advocate Wellness, so that's great. We also provide some myofascial therapy. Now, stretching and helping the muscles is really no good until it's not a spasm anymore. And that's a crucial difference between spasms and tightness. If you're stretching and you're stretching that muscle for about a minute and then it finally lets go and it loosens up a little bit, you stretch for about another 30 seconds to a minute and it lets go again, you're dealing with tightness. But if you can stretch that muscle for a minute, 2 minutes, 3 minutes, and you're breathing deeply and you're trying to relax and it just won't let go, you're very likely dealing with a spasm. And that means that's a neurological tightness, not a muscular tightness. So trying to stretch it is not going to be as helpful. And that's where we come back to this traction right here, where we provide some gentle tension. We send home units for people to lay back on. It has an inflatable pillow and it provides some gentle tension across the spine, helping open up those joints, helping the nerve be able to breathe and calm down so that the muscles will finally let go. The spasms are really symptoms of a higher order problem, they are a problem in and of themselves. Now, word of warning about muscle relaxers. Now, short-term muscle relaxers are amazing because they provide people with relief. And that's great because, well, people need to sleep and they need to be able to function on some level. But long-term, what happens is that muscle relaxers will turn off all the stabilizing muscles for the spine and put it at risk of consistent long-term injury if those muscle relaxers are taken for too long. So sometimes in order to break that cycle and calm the nerves down, we will co-manage with an ortho or take a patient who's just come back from the ER because they might be dealing with so much pain and spastic tightness that those muscle relaxers are a godsend. And guys, I'm not particularly pro-drug either way, but in that case, that is one of the most justified cases of a prescription I know of. And I just want to be real about that with you. And especially with the health nuts out there that are like, all drugs are bad. No, not necessarily. In this case, that is such a relief and it provides such quality of life for people that it's a very justified use. Now, long-term though, not a great idea because it does put the spine at risk of being destabilized for too long, leading to more damage building up. So, spasms, traction, adjustment, red light therapy, muscle therapy. Once the spasm goes away and we're just down to dealing with tightness, at that point, we can kick in with our regular chiropractic protocols and find that effect there. And if we can't get people over that edge relatively quickly, we know within about 2 to 4 weeks whether or not we can get someone there. If not, then we're referring them out to another of our amazing partnered clinicians in the community. Guys, thank you so much for watching. If you're interested in coming see us, call us and schedule a consult and exam.